I am Dr. Kalyan Chakravarti. I am one of the consultant cardiologists in Kamineni Hospital, King Koti. Today we are here to discuss about heart attack. Most of you have heard about heart attack, and this is a very common condition in Indian scenario. Compared to Western scenario, Indian scenario, heart attacks are more, and there are various factors that can cause heart attack. Some of the factors include high blood pressure, high cholesterol levels, long-standing diabetes mellitus, any family history of heart disease, and also some drugs can cause illicit drugs like cocaine can also cause heart attack. The main thing with heart attack is most of the patients who got heart attack, 50% of the patients will die before coming to the hospital. So that makes heart attack a very dangerous disease to be cured. Once the patient reaches the hospital, see whether the patient is having heart attack or not. So what are the symptoms of heart attack? Heart attack symptoms start suddenly. Usually the classical symptom of heart attack is chest pain. Chest pain which can radiate to the left upper arm, radiating to the jaw, radiating to the angle of the mandibles, radiating to the neck. All this can mimic heart attack. Once you suspect that you are having chest pain and which was sudden in onset and it is continuously progressing, then you consult a doctor who is nearer to you, so that you can be diagnosed with heart attack very early stage. There are various investigations where you can diagnose a heart attack. The first one is electrocardiogram, the second one is echocardiogram, the third one is blood test, and the fourth one is the obvious angiogram. So I will talk about ECG first. Whenever a patient has a chest pain and supposedly it is heart attack, in the initial stages the patients may not have ECG changes. So heart attack patients might be missed because of a normal ECG and a chest pain. They usually think that the chest pain is not because of heart attack and they leave the emergency room, and after 1 or 2 hours they come back to the ECG saying that pain is persistent, and once we again take the ECG, that ECG shows that the patient is having heart attack. So what to do when you have a chest pain which is classical of heart attack is you take a baseline ECG, and after every 30 minutes up to 2 to 3 hours take serial ECGs, so that myocardial heart attack that evolves, and these changes can be seen on ECGs over the time. This is about ECG. And the second thing I have told you is 2D echo. 2D echo is one of the earlier investigation to pick up heart attack. So if you do a 2D echo, if there is any regional wall motional abnormality, that means if there is any wall of the heart moving abnormally, that suggests heart attack. And the third thing, like I have said, is blood test. Blood tests in the initial period, in the initial 1 hour, they may not be raised. So to comprehensively rule out a heart attack, initially what we do is we take a baseline blood test for heart attack, and if it is raised, then we label him as heart attack. If it is normal, after 3 hours we take another sample to rule out heart attack. If these two samples are normal, then we can conclusively say that the patient is not having heart attack. And if you conclusively want to rule out heart attack, then the main thing is angiogram. Angiogram conclusively rules out if there is any obstruction in the blood vessels of the heart which causes heart attack. So this is about the how you diagnose a heart attack. Coming to the treatment, once you are diagnosed to have a heart attack, it's an emergency. Once you are diagnosed with the heart attack, within 12 hours you need to get an angiogram done and you need to get a angioplasty done if there is any block. Okay, once you are diagnosed to have a heart attack, they will take you to there are two modalities of treatment for heart attack. One is thrombolysis, that is a drug which is given through your peripheral veins, and other one is angiogram and stenting. Okay, thrombolysis is done where the hospital is not equipped with cath lab and angioplasty, and thrombolysis is preferred in areas where cath lab is not available. If cath lab is available, then the primary treatment of choice is angiogram and primary angioplasty. So they take you to a cath lab, and either through the hand or through the leg they will put a cannula and they will pass tubes into your heart. They will inject dye and see whether any blood vessel is blocked. If the blood vessel is blocked, that indicates that the patient is having heart attack. Once the blood vessel is blocked, the main aim of the doctor is to open the blocked blood vessel. Okay, initially they do open it with a balloon, and once the block is opened with a balloon, they put a stent. Once the stent is kept, then the myocardium, the heart muscle which is getting damaged, will be preserved, and heart as a whole can recover. This is the treatment of heart attack. Apart from this, they will be giving some blood thinning drugs, and you will be kept in the ICU for 1 or 2 days. After that 2 days, you will be kept in the ward, and after that you will be discharged. And the main thing I want to emphasize is prevention is better than cure. To prevent heart attack, you identify the risk factors. Risk factors like diabetes, hypertension, immobility, obesity, family history, and high cholesterol levels. These are all the things that can lead to heart attack. If you keep them in control, then there is a fair chance that you might not get a heart attack. Thank you.